Okay, so my name is Daniel Quesada Riboletto. I have been working for some time here in the province of Ontario in the country of Canada alongside newcomers and other displaced populations. And the purpose of today's presentation is just to run through some of the work I've done alongside these populations in the past, working alongside them, supporting them to the best of my ability. And I'm hoping to make some connections for you around the social determinants of health for these populations. So just as a brief overview, who am I? My name is Daniel Quesada Riboletto. I am born and raised here in Cobourg, Ontario, Canada. My family is originally from Costa Rica and Chile. I speak English, French, and Spanish. And in the context of my work professionally, I have around 10 years of experience in the social services or human development sector. I worked in international development for quite some time, mainly in Central America and Mexico. And my primary focus there was in maternal, newborn, and child health in Guatemala, and specifically in the southwestern region of Guatemala called Totonicapán, which is a primarily indigenous province or department, as they call it in Guatemala. Additionally, I've been also working for quite some time with what are known as temporary foreign workers in the province of Ontario. I also have some recent experience working alongside and supporting victims or survivors of labor trafficking here in Ontario. Some recent experience working alongside individuals experiencing unsheltered homelessness here in Ontario as well. So let's talk about the influx of displaced populations, specifically here to Canada, or more specifically to Ontario, the province that I currently live in Canada. So there's been a recent waves of displaced populations arriving from Africa. Some countries that come to mind are like Nigeria, Sierra Leone, just a couple to name right now. The reason for leaving Africa is varied, and it's often a combination of several factors, but religious persecution is definitely a factor, political instability, economic challenges, and other human rights violations. I know that there is ongoing human rights violations around LGBTQ plus rights. So folks are sometimes leaving certain countries because their life can't be guaranteed if they are gay or lesbian or transgender, for example. So those are some of the these are some of the reasons why folks are leaving certain countries and looking for asylum and stability here in Canada. There are other groups and populations that are arriving to Canada from ongoing conflicts, including those from Afghanistan and the Ukraine. And on top of all this, there are a number of what we call irregular arrivals including what are tourists from Mexico and other countries, whereby they come to Canada as tourists on tourist visas, but they are oftentimes displaced from their own countries in terms of economic opportunity. They can't find work, they can't find jobs. They manage to get a tourist visa and come to Canada, not necessarily to be a tourist, more so to work and find a new life. And those are things that we've seen day in, day out in the social services sector for at least very strongly the last couple of years. And specifically, a country that comes to mind is Mexico. There are quite a few folks from Mexico coming as tourists, but might not necessarily be here for tourist purposes, rather to work and to build a life here. And so these are just a couple of examples of some displaced populations here in Ontario that we'll build upon during this presentation. I also want to talk about another group of people here that are newcomers and could be seen to be displaced, and that in their home countries there isn't necessarily economic opportunity. Therefore, they come to Ontario or Canada seeking work and opportunity to support their families back home. This is mainly done through what's called the Temporary Foreign Worker Program, the TFWP for short. Basically, workers come to Canada due to lack of economic opportunities in their home countries. Here in Canada, there are employers that want to hire migrant workers to fill labor gaps. Key industries where this is happening, as these photos suggest on the slide, agriculture, construction, hospitality and tourism, food and beverage production, and healthcare, and what are known as like caregivers. So essentially what's going on here is there are a number of sending countries like Mexico, a variety of Caribbean nations like Jamaica, Trinidad and Tobago, Philippines, India, Guatemala, and Honduras. And there are individuals in those countries who are able to apply in those countries to come to Canada on closed work permits and come to Canada to work for a specific employer. So what it means is if I'm a person in, let's say, Mexico, I can apply through my Ministry of Labor down there and eventually get matched up with an employer employer here in Canada, come to Canada and work for a specific amount of time only for that employer. I couldn't necessarily work for other employers because I'm on what's called a closed work permit. And I can earn money here in Canada for the duration of my contract. Sometimes the contracts are short, a few months at a time. It could be a year or 2 years, for example, at which point workers would return home and then do that process all over again. Come, apply again or have a visa renewed, a work permit renewed, I should say, and then come back to Canada and work again. And some people do this over and over and over again for 5, 10, 15, 35, 40 years, right? Coming to Canada over and over again to have an opportunity to work and to provide for their families. Unfortunately, there are a number of documented human rights issues and human rights abuses, issues with housing around this program. If you quick Google search migrant workers on Canada and abuse, you'll see some examples of that, and we'll touch on some of that here shortly in the presentation. Social determinants of health are non-medical factors that influence health outcomes. They shape the conditions in which people live, work, and interact, directly impacting well-being. For displaced populations, systemic barriers across these social determinants of health lead to poor physical and mental health outcomes. So some key social determinants of health that I want to point out in this presentation for our displaced populations, our newcomers, temporary foreign workers that are here. Housing. Housing is a pretty big determinant of health for many of our migrant workers, of the newcomers that come here to Canada, in that housing, the stability that it can or can't provide, the safety of that housing, and access to affordable shelter can concretely impact these populations' health here in Canada. Employment, what is the quality of the jobs that they're getting? Are there fair wages being paid? What is their job security, right? These are things that I'll cover here shortly. Healthcare access. Do these populations is the healthcare available to them on a regular basis? Do they know of the services or healthcare services that are being provided? Do they have the proper documentation, like their OHIP card, to be able to access healthcare? That's another key point. In terms of education, is there opportunities for them to learn, to grow in their roles in their job, for skills development, for language acquisition? Many of the countries that I mentioned earlier, English isn't the first language of some of those countries, right? So when they come here to Canada, are they having an opportunity to learn English so that they can effectively access healthcare and do some of the many things that all of us do every day in society, like go to the bank, go to the grocery store, build community, make friends, go to church, take a bus ride. Those things, some of those things require some level of knowledge of English, right? And so how might that play into someone's health? And then social support. Another key determinant of health for newcomers. What are their community networks? What are to what extent do they have social inclusion or the ability to socialize on a regular basis? To what extent is there mental health support for newcomers and displaced populations when they're here finally in Canada? So we'll just touch on these in the next slides here. So in terms of housing for newcomers, it really varies. But there are some marked issues ongoing here in Ontario and in Canada in terms of newcomers and displaced populations, asylum seekers, temporary foreign workers, and being able to have affordable housing and the impacts that lack of affordable housing has. Right. Some of the photos that you see on the right-hand side here, and the ones on the bottom, those are some housing conditions that some temporary foreign workers had to face. They were overcrowded. The quality of housing that they had wasn't up to par. There were many issues in terms of their housing quality and standards for some temporary foreign workers here in Ontario. So lack of affordable housing can lead to overcrowding. It can lead to potentially homelessness. The use of temporary shelters, including motel programs, or even just warming centers and shelters as it is. Substandard living conditions, because there's a lack of affordable housing, and there's been such a housing crisis here recently in Ontario, wherein there really is no available affordable housing. People are having to make do in terms of living in substandard living conditions, living in living conditions that have mold. There's poor ventilation. There's pest infestations like bed bugs, for example. These all pose significant health risks, right? So what's the impact of lack of affordable housing, lack of housing, overcrowded, housing conditions, living in, motels and things like that? Well, there's an increased risk of mental health issues. People don't feel people people feel disrespected. People feel unseen, right? When they're having to live, 8, 10, 12, 14 people in one room, for example, right? You're also risking issues with, roommates when you have so many people in one room, as you can imagine, right? Increased risk of mental health issues, obviously the spread of infectious diseases, which was huge during the COVID pandemic. Temporary foreign workers and folks living in, crowded housing conditions were at, an increased risk of getting COVID-19 and spreading it. And there was an entire situation with temporary foreign workers across Canada being, infected by COVID-19 as a result of, of their overcrowded living conditions. Right, that's something you could look up too. And from all this, I mean, there's worsening of chronic health issues. Newcomers, just like you or I, may or may not have, chronic health issues like, high blood pressure, diabetes, for example, and other things. So, having all these things on, having those chronic health issues plus living in overcrowded housing conditions, only can sometimes make those chronic health issues worse, right? Employment. So talking about this social determinant of health of employment, it's so important, right? Because we spend so much time at work, probably half our life is spent working or somewhere around that, right? A lot of time at the very least. Newcomers or displaced populations, temporary foreign workers, often work as my as a former colleague, Gabriel Adua, who wrote a book on temporary foreign workers. He calls it the DDD jobs. That's what he calls it. They're jobs, newcomers often work dirty, difficult, dangerous, and deadly jobs. Agriculture, construction, manufacturing. They're oftentimes dirty jobs. You're on your hands and knees all day. It's difficult. You're carrying things, you're moving things around. You're always on your feet. There's it's sometimes dangerous when there's heavy machinery involved and things like that. And oftentimes, and sometimes, in some cases, it can be deadly, right? So that's tough. It's tough work. I know that here in Canada or here in Ontario at the very least, growing up around newcomers, oftentimes so many newcomers when they first come to Canada, they're working in landscaping, in housekeeping or in cleaning jobs around certain chemicals and things like that, warehouse jobs, manufacturing, agriculture, right? And some of these jobs are often, as we go into the next point here, precarious employment, often low wage. It's minimum wage. And for temporary foreign workers, it's closed work permits, right? They don't have the ability to move between jobs. They're stuck or they're tied to one employer. On top of all this, being newcomers to Canada, you may have limited knowledge of your own rights as a worker. When you first move to a new country, what are my rights as a worker? Like if you took me today and placed me in, I just name a random country, Albania. I don't know what my rights would be as a worker in Albania, right? I would have to learn that. I don't speak the language. I don't know who I could turn to trust if I'm having an issue with my employer. Those are all things that might affect you as a newcomer to a new country. Additionally, there are issues with credentials. So, there's a classic, dilemma that a lot of newcomers face when, they come to Canada. Back home, they're a nurse, they're a doctor, they're an engineer, a project manager, an accountant, whatever the case may be. When you come to Canada, oftentimes your credentials, your education history isn't recognized. There are certain accreditation, there's certain accreditation required to be, for example, a doctor or an engineer or an accountant here in Canada. That obviously you wouldn't have that exact those exact diplomas or whatever the credentials are. You might have it in your home country of Mexico or Syria or wherever, but it doesn't apply here in Canada. So even though you may have been an engineer back home, here you're more than likely going to find yourself to start in your career here in Canada in one of these DDD jobs, as we say, working in construction, landscaping, and things like that. The health impact of all this. Well, working these types of jobs, physical injuries, repetitive strain injuries are very common. The stress, the mental health issues. Imagine back home, you're a doctor, an engineer, whatever, and then finally you make it to Canada, and your job now is something in agriculture. You're picking, bok choy, you're picking apples and things like that, right? You can imagine maybe even the identity crisis that you might face as a newcomer, finally coming to Canada, finally thinking I have a chance to get my life, to get some stability in my life. And so, and facing that, right? You can see the mismatch and how that might play a role in your health. Healthcare access. To this extent, newcomers to Canada, barriers to accessing healthcare, lack of coverage in some cases, in some situations like the folks who come here on tourist visas, or when people are first coming to Canada to seek asylum as refugees, for example, they may not immediately have access to their OHIP, to basic health coverage here in Ontario. There have been issues in the past with temporary foreign workers not getting their health cards right when they come to Canada and things like that, and the issues that might cause if they first arrive to Canada, they don't have their health card, they need some medical support, they go to the hospital, they're asked to present their health card, so they don't have it. That can cause some issues in terms of accessing healthcare. In terms of other barriers, language barriers, let's say you finally do have your health card, you want to go to the hospital or the walk-in clinic or wherever to get health care. They don't speak your language, and there's no translation available immediately. The frustration that might cause the barrier. Why would I go back to the hospital where I can't even speak to them? We're just playing, a game with Google Translate, even if it's available, right? So that can be a frustrating situation for folks. Transportation. A lot of folks are living in rural communities or don't have access to adequate transportation to get to the hospital to and from. That's a barrier. Maybe we don't go, right? No family doctor, and then long wait lists for family doctors. Often, what that means for a lot of newcomers and displaced populations is healthcare becomes emergency only. Like I won't go to the hospital for small things that I need to do in terms of managing maybe chronic health issues. I'll just wait till those become more of an emergency, then I'll just go to the emergency room, emergency department, or an urgent care center, right? That's what a number of clients have done in the past is they just they might not manage their diabetes as they were back home, for example, because they don't know how here in Canada. And so just once it becomes a really big issue in their life, then they'll go to the emergency department and get some support there. And then unfortunately, they may just keep going back to the emergency department until eventually they're able to access a more appropriate resource for them, right? This means postponing treatment and health needs, as we just covered. The health impact of this, delayed treatment, unmanaged chronic conditions, and also, just that whole frustration of that process is, it's draining on your mental health too, as you can imagine. In terms of social supports and languages, I always tell folks, like, imagine going to a new country. You don't know anyone, right? You don't necessarily have any friends, any community. Maybe you have no family there in your new country. When you face an issue in your life, oftentimes you can turn to family and friends and maybe a social group, some sort type of community group that might help you. Church is a big thing, or it was in the past, and it still is to some extent, right? Those are when you come to a new country, you might not have any of those things, right? So lack of community, can play a pretty big role in terms of how you're able to overcome obstacles, right? Not having those language skills inhibits your ability to form community, right? If you're moving to Canada and you don't speak English, it's going to be increasingly difficult to make friends or build community, right? Um, this often leaves people feeling disconnected from any meaningful support or systems, and it creates increases stress, increases anxiety, increases depression. People feel isolated. People feel unsupported. I always tell a story of a temporary foreign worker I knew for so long. He had been coming to Canada for 2 years straight. He had never really spoken to anybody other than his employer, right? Just one person he would speak to on a regular basis who didn't speak his language, right? And he never had the opportunity to socialize. And he always said he felt so alone, so estranged. He didn't really even know where he was in Ontario, right? He would just be taken from Pearson Airport to whatever farm he was at, and it didn't matter what village he was in or what town he was in, because he didn't have anybody else there anyway. So it didn't really mean much for him, right? So that's a challenge, right, in terms of your health if you have no one in a community, right? So some key takeaways that I want to cover from this. Displaced populations face unique challenges in navigating the healthcare system. I think that isolation plays such a huge role. Being new to a country and not knowing where to get help, who you can trust to provide you the information to get help is so key, right? We've covered that social determinants like housing, employment, and social support are critical to understanding health outcomes. Having substandard living conditions can be very, very tough on folks. I mentioned that, seeing housing conditions with mold, massive overcrowding, poor ventilation, the effects that can all have in your health. The role your employment plays, right? Like I mentioned earlier, you come to Canada and you're finally ready to work, and there's a mismatch there in terms of what you were hoping to do for work and what you were hoping to get for a salary versus the reality. Whereas you might be doing one of those dirty, deadly, dangerous jobs that we had mentioned earlier, right? And social supports, the lack of social supports can play a pretty big role on folks coming here to Canada. And so I know this is a nursing class, so I think healthcare providers could be aware of these determinants when treating newcomers, right? Knowing, keeping these things in mind when you're working with these populations, I think might be key because oftentimes, as we sort of covered in this presentation, the mental health part absolutely plays a role on their physical health too. And so, yeah, that's the presentation for today. I tried to keep it short and looking forward to any further discussions. Thank you.